Hi, I'm Narisa De Silva, and I'm gonna talk about vital signs, also known as vitals. It's assessing the general physical health of a person. Many purposes why doing these vital signs. Purposes: to assess client's condition, to determine the baseline values for future comparison, to detect abnormalities in the condition of the patient. There are 4 vital signs that indicates the status of the body's vital functions. We have body temperature, blood pressure, heart rate, and respiratory rate. For body temperature, the normal range is 36.5 degrees Celsius or 97.8 degrees Fahrenheit. It varies depending on the age, gender, recent activity, food or fluid consumption, and in woman, the menstrual cycle. There are different ways to test the body temperature. Oral temperature. Taken by the mouth using digital thermometer, 2 minutes under tongue, normal range 35.5 to 37.5 Celsius. Rectal temperature. Taken rectally or in the anus using digital thermometer, normal range 36.6 to 38 degrees Celsius. Tympanic temperature. Taken by external ear, ranges to 35.8 to 38 degrees Celsius. Temporal temperature. Taken in the forehead, it is the most convenient using a temporal scanner. Axillary temperature. Taken under the armpit for 3 minutes, ranges 36.2 to 37.5 degrees Celsius. So I'll show you the step-by-step procedure in taking axillary temperature. First, wash your hands to prevent infections, or you can use alcohol-based sanitation. And then, prepare all the required equipment. A record book, ball pens, wet tissue, surgical mask and sponge towel, digital thermometer, cotton swab, and tray to set all the materials. If your client is an adult, explain the purpose and procedures to the patient so that he or she is aware why you are giving this kind of test. First to do, take the thermometer using a cotton balls or cotton pads with alcohol. Clean it from the bulb towards the tube. From cleanliness to dirtiest part. And also check if it's not low bat. The reading must be in a low rate or 35 degrees Celsius. Assist the patient to a supine or sitting position. Tell him to relax. Move the clothing away from the shoulder and arm to expose the armpit. And then, place the tip of the thermometer in the center of the armpit. Make sure the armpit is dry. If it's moist, pat it dry gently using a towel because moisture will alter the correct reading. Tuck your patient's arm closely against their body, upper arm against the chest to keep the thermometer in place. Leave it in place for about 3 minutes until you hear the beep sound. Remove the thermometer and read the measure, and then explain the patient if he or she has a fever. And then, keep the temperature record. Write down the time, the date, and its reading. And again, your used thermometer, clean it with cotton and alcohol from its dirtiest to cleanliness part. And don't forget to report to your superior if you find any abnormal reading, or be alert for the next procedure to test. We are now demonstrating body temperature through axillary method. Thank you for watching and have a good day!